Welcome to Psychology Insights Explained, or PIE. Here's a slice of pie. Today's slice will explore a condition that affects millions but is often misunderstood: borderline personality disorder, or BPD. Imagine a life where your emotions are like a roller coaster, swinging from intense joy to crushing despair in the blink of an eye. Feelings of emptiness and fear of abandonment are ever present, making it difficult to maintain stable relationships. This is a glimpse into the world of BPD, marked by emotional instability, a distorted sense of self, and impulsive behaviors. BPD is often shrouded in stigma and misconception, making it challenging for individuals to seek help and for others to understand their struggles. The truth is, BPD is a complex mental health condition influenced by a combination of genetic predisposition, environmental factors, and brain chemistry. In this video, we'll explore the intricacies of BPD, including its onset, symptoms, diagnosis, and treatment options. Our goal is to provide you with evidence-based information, expert insights, and real-life scenarios to shed light on this disorder. Borderline personality disorder often takes root in childhood, during those formative years when our sense of self and the world around us is developing. Traumatic experiences, such as childhood abuse, neglect, or witnessing domestic violence, can leave deep emotional scars and disrupt the development of healthy coping mechanisms. Imagine a young child growing up in an environment where their emotions are invalidated, or they are constantly exposed to chaos and instability. This lack of a safe and nurturing environment can profoundly impact their emotional development, making them more vulnerable to BPD later in life. While childhood experiences play a significant role, genetics also contribute to an individual's susceptibility to developing BPD. Research suggests that individuals with a family history of personality disorders or mental illness may be genetically predisposed to developing BPD themselves. Studies have shown that certain areas of the brain involved in emotional regulation and impulse control may function differently in individuals with BPD. This combination of genetic vulnerability and environmental stressors can create a perfect storm, increasing the likelihood of BPD manifesting. Understanding these factors can help in developing more effective treatments and interventions for those affected by BPD. There are many challenges and misconceptions with BPD that can make life difficult. Living with BPD can feel like navigating a minefield of emotions, relationships, and self-perception. The intense emotional swings, fear of abandonment, and impulsive behaviors can make it challenging to maintain stable relationships, hold down a job, or simply enjoy life's simple pleasures. Unfortunately, BPD is often misunderstood, and individuals with this disorder are often stigmatized as being manipulative, attention-seeking, or simply difficult. This couldn't be further from the truth. People with BPD are often struggling with intense emotional pain and desperately seeking ways to cope and find relief. There are a few core symptoms of BPD. One of the hallmark symptoms of BPD is emotional dysregulation, or difficulty managing and responding to emotions in a flexible way, often described as an emotional roller coaster. Imagine experiencing emotions with an intensity that's difficult to control, where even minor events can trigger extreme reactions. For individuals with BPD, feelings of sadness can quickly escalate into overwhelming despair, while moments of joy can be fleeting and followed by emptiness. This emotional volatility can be incredibly challenging to manage, often leading to impulsive behaviors, difficulty in relationships, and a sense of being overwhelmed by one's own intense emotions. Fear of abandonment is another core symptom of BPD. A pervasive fear of abandonment is always a threat with BPD, driving individuals to go to great lengths to avoid real or perceived rejection. This fear can manifest as clingy behavior, extreme jealousy, or a desperate need for reassurance in relationships. For someone with BPD, the thought of being alone or abandoned can be unbearable, triggering intense anxiety, anger, or even self-destructive behaviors. This deep-seated fear often stems from early childhood experiences of neglect, instability, or inconsistent caregiving. Therapy can offer hope for recovery and provide the pathway toward a better future. The struggle for connection in BPD is a real challenge. as another core symptom is unstable relationships. The intense emotions and fear of abandonment associated with BPD can significantly impact relationships, often leading to a pattern of unstable and chaotic connections. Individuals with BPD may idealize their partners at the beginning, putting them on a pedestal and seeking constant validation. When their expectations aren't met or they perceive a threat of rejection, they may quickly shift to devaluation, seeing their partner as entirely bad. This black and white thinking, coupled with impulsive behaviors and difficulty managing emotions, can create a vicious cycle of conflict and emotional turmoil, making connections challenging. The first step towards a diagnosis of BPD is to seek professional help. If you or someone you know resonate with the scenarios or symptoms we've discussed, seeking professional help is crucial for accurate diagnosis and effective treatment. The journey towards understanding and managing BPD typically begins with a visit to a mental health professional, such as a psychiatrist, psychologist, or licensed therapist. Don't hesitate to reach out for support. These professionals are trained to assess mental health conditions and can provide a safe and confidential space to discuss your concerns. Remember, seeking help is a sign of strength, not weakness, and it's the first step towards reclaiming your life and building healthier coping mechanisms. To better understand BPD diagnostic criteria, we will take a closer look at the DSM-5. Mental health professionals use a book called the DSM-5 to diagnose BPD. It's the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders. Using this book, 9 criteria are evaluated for diagnosing BPD. They are fear of abandonment, unstable relationships, persistently unstable self-image, self-damaging impulsivity, suicidal behavior, mood instability, chronic emptiness, intense anger, and stress-related paranoia. At least 5 of these criteria must be met to consider a diagnosis of BPD for a thorough evaluation. Before diagnosing BPD, differential diagnosis is used to rule out other conditions. Diagnosing BPD can be complex, as its indicators often overlap with other mental health conditions like bipolar disorder, depression, or anxiety disorders. Mental health professionals conduct differential diagnosis by considering an individual's medical history, symptoms, and the duration and severity of their experiences. This helps rule out other conditions and ensures individuals receive the most accurate diagnosis and appropriate treatment. Proper diagnosis is essential for developing an effective treatment plan and providing individuals with the support they need. The therapeutic landscape for BPD has several options. Therapy is often the cornerstone of treating borderline personality disorder, and various therapeutic approaches help individuals manage their symptoms more effectively. Cognitive behavioral therapy, CBT, focuses on changing negative thinking patterns and behaviors. Dialectical Behavior Therapy, DBT, combines emotion regulation with acceptance and mindful awareness to teach skills for coping with intense emotions and self-acceptance. This dual approach can be particularly powerful in treating BPD. We will discuss these treatments in more detail in another episode. Medication can assist in the treatment of BPD. While therapy is a primary treatment for BPD, prescription drugs can also play a supportive role. There is no specific medicine approved to treat BPD, but certain medications can help alleviate some symptoms. Mood stabilizers and antidepressants might be used to reduce mood swings and depressive symptoms. Medication does not cure BPD but can help alleviate and manage symptoms, aiding therapy and daily activities. A healthcare provider will help find the most suitable medication plan as part of a comprehensive treatment strategy. Living with BPD requires lifestyle adjustments and stable support systems. Managing BPD isn't just about therapy and medication. Lifestyle adjustments and strong support systems are crucial. A stable, stress-free environment helps reduce emotional outbursts. Physical activity, sleep, and a nutritious diet aid emotional regulation. Yoga and meditation enhance mindfulness and stress management. Support systems like family, friends, or therapy groups provide emotional support and reduce isolation. Recovery from BPD is a continuous journey, and with the right strategies, individuals can lead fulfilling lives. Family and friends should support their loved one and share in the journey with BPD. Understanding borderline personality disorder is a shared responsibility. When family and friends educate themselves, challenge stigma, and offer support, they can gain empathy and better understand their loved one's condition. BPD is a serious mental health condition, not a character flaw. Behind the diagnoses are real people facing daily challenges. So, work hard to foster empathy and challenge misconceptions to provide the best support system. The assistance of family and friends can make a huge difference in the lives of those affected by BPD. If you think you might have BPD, embrace hope and seek support. Living with BPD can be challenging, but personal growth and healing are possible. With the right support, individuals with BPD can manage their symptoms and lead successful and happy lives. Remember, you're not alone. Reach out to a mental health professional with your concerns and look for a support group for encouragement on your journey. Thank you for joining us, and don't forget to like, subscribe, and share this video. Together we can make a difference. Until next time, this is Psychology Insights Explained.